because just of the daily run of radiation clinic, it's a complex planning process between all these different individuals and treatment as well. We found that they were running around all day trying to find a physician to do a particular task or to ask a particular question. So it was a very inefficient way of communicating without some sort of little meeting. That's where we developed our crew resource huddle, and we also revamped our morning rounds. So our morning rounds has all of our physicians, all of our nurses, it has our chief therapists, our physicists, dosimetrists, and usually our simulation therapists. And we remodeled it so that we were going over more particular communication for that day. Another key tool that we developed was the emergency treatment poster. And what that is, there's a poster and there's also a form. And beforehand, you'd get communication and it was very choppy and not everybody was sure what was going on with this emergency patient. Just developing this form and this process enabled us to get a small team of individuals together, the simulation therapist, a nurse, and a treatment therapist, and also a planner, so either dosimetrist or physicist. And they come together before the patient is even brought down or is down in the department before they come near the machine, and they review some certain aspects about emergency patients that you would not have to review with a regular patient. Such as their breathing, their ability to lie down flat, just what type of status they're in, and how they can tolerate the treatment, their pain toleration. So those things we really didn't look at before, and sometimes the therapist would just put the patient on the table to try to rush and do what we needed to do for an emergency, but we'd run into issues that we weren't reviewing, and it became more of a complex thing to deal with.